Hi, everyone. I just want to go over some key ethical principles that are important to understand for being a nurse practitioner and certainly for your certification exam. There are questions on this topic as well. So the core ethical principles in medicine. Ethics is the study of moral conduct and behavior which serves to govern and conduct, thereby protecting the rights of an individual. And here's the Code of Ethics for Nurses. And the American Nurses Association Code for Ethics for Nurses has these 9 provisions and support statements. And it supports 4 main principles of ethics. We're going to talk about 7 main principles, but this talks about the 4 of the 7 that we're going to talk about in ethics: autonomy, justice, beneficence, and non-maleficence. The provisions assert the ethical and moral foundation of the nursing profession. So I'm not going to read through all of these. I think you know these. I think they make sense. I mean, certainly you can pause here and go through those. But that's what the Code of Ethics is based on, these principles that we're actually going to talk about right now. So let's start this with the 7 key ethical principles. And the first one is non-maleficence, and that is the duty to do no harm. And the definition is non-maleficence is a principle in ethics, particularly in medicine and healthcare, that emphasize the obligation not to inflict harm intentionally. So the duty to not do harm. Do no harm. This principle asserts that it is unacceptable to harm a patient or client, even if the intention is to promote a greater good. And here's a couple of examples. Avoiding over-medication would be one. A physician not prescribing painkillers to a patient showing signs of addiction, recognizing the potential harm of dependency. So it's unacceptable to harm a patient or client, even if the intention is to promote a greater good. Surgical considerations. A surgeon might decide not to perform a high-risk surgery on an elderly patient if potential complications are too risky. So he has to make that decision, doesn't want to do more harm than good for this person. So this is basically about weighing benefits and risk, the risk-benefit ratio of any treatment, like these examples show, that include medication or surgery. And the Hippocratic Oath lists specific acts of non-maleficence actually in it. And these acts include euthanasia, abortion, okay, that's the duty to do no harm, an attempt by the professional at procedures outside this person's area of expertise. So if it is not your area of expertise, it is not something that we should be doing. RNs do not put in central lines, okay? That is a standard, so we don't harm somebody who have to go through the proper training to do it. Stealing property, making sexual advances. Okay, there's a lot of different examples that can go under here. Violating privacy, just avoiding negligent care of a patient. The next one, utilitarianism, the right to act, is the one that produces the greatest good for the greatest number of persons. Principles or laws that are around non-discrimination are examples of this. Considering somebody's advanced age or maybe their disability or somebody who has severe dementia when we're allocating resources, for example, like ventilators. So allocating ventilators only to those with the highest likelihood of a therapeutic success because there would not be enough to go around. So sometimes these decisions that we make, might not be the right decision because we can't really predict the future, and it's difficult to know with certainty whether the consequences of our actions are going to be good or bad. And that certainly would be a limitation of utilitarianism. Another limitation is that utilitarianism has trouble accounting for values like justice, individual rights. Like, for example, and this is an example that's used in a lot of, examples talking about utilitarianism. Assume a hospital has 4 people whose lives depend on receiving an organ transplant. Somebody needs a heart, somebody needs a lung, somebody else needs a kidney, and somebody else needs a liver. Well, if a healthy person wanders into the hospital, we could harvest this person's organs to save 4 lives at the expense of 1. This would arguably produce the greatest good for the greatest number, but I don't think many of you would consider this as an acceptable course of action, let alone an ethical one. So there are limitations when it comes to utilitarianism. The next one, beneficence, the duty to prevent harm and promote good, doing what is best for the patient's interest. Beneficence is a principle in ethics, especially in healthcare and medicine, that emphasizes the moral obligation to act in the best interest of individuals or the public to promote their well-being. It goes beyond merely avoiding harm. It goes beyond this. Okay, that's the difference, and requires taking proactive steps to help others and improve their condition. Examples: an organ transplant. Hospitals facilitate organ transplant procedures to save or significantly improve the lives of patients with organ failure. The duty to prevent harm, the duty to promote good. A scholarship program. Philanthropists offer scholarships to financially disadvantaged students, enable them to pursue higher education. This is the duty to promote good. That's an example of that. Basically choosing the best treatment available for that person, following procedural guidelines. There's guidelines and standards of care that are in place. And this includes treating a patient even if this patient cannot afford to pay for the treatment, which would prevent harm to this person and certainly promote good. The next one, justice. Justice is pretty simple. The duty to be fair, treating patients equitably and fairly doesn't mean equally, okay? Equitably does not mean equal. Everybody gets the same thing. For example, in the ER, if a patient with an urgent life-threatening illness would be treated over somebody who comes in maybe with something else, like a small trauma, okay, that's not equal, but that is equitable and that is fair. New life-saving vaccines should be made available whether somebody could afford it or not. That's equitable. The next one is fidelity, the duty to be faithful. Fidelity is a moral principle, and it's integrally tied to nursing and the nursing profession due to the importance of maintaining trust. Okay, nurses are a highly trusted group, and integrity in the nursing profession. For example, a commitment to fulfill a promise. I will order you some pain medication. Okay, then that needs to be done. Protecting patient confidentiality is another example of being faithful to somebody instead of broadcasting to all your friends what's going on with that person. If the information about a patient does not need to be shared to provide necessary care for this person, then this information should not be discussed or shared with other people. Next is autonomy and veracity. So autonomy, the duties of respecting individuals' thoughts and action. Definition: autonomy refers to the capacity of a person or entity to make decisions and act according to their own rules or principles, free from external control or influence. They have the ability to make decisions and not be influenced by an outside party. It emphasizes self-governance, independence, personal freedom. In various contexts, it can pertain to individuals, groups, or machines. Many moral philosophies hold that it's a fundamental human right. And examples: personal autonomy, an individual choosing their career path based on a passion rather than what a society would expect them to go into. And national autonomy, a country making decisions about its internal policies without interference from external powers. Ha, ha, ha. So the patients have freedom to make their own decisions without any external influence. And the nurse practitioner has to honor a patient's autonomy. So the nurse practitioner has autonomy on their own and of their own situations. For example, in which a nurse practitioner can refuse to provide treatments, like not only does patients have autonomy, but nurse practitioners have autonomy. Refusing to perform a C-section for a patient who lacks a medical reason. So somebody goes, well, I want a C-section and I want it on this day. And the healthcare provider has autonomy as well and says, I'm not going to perform a C-section on you because there's no medical reason that states that you need to have a C-section. So basically the patients just can't dictate everything. So that's an example of a situation where a patient does not have autonomy. Another example, a patient with active tuberculosis, they have to take treatment. They don't want to take treatment, but some states actually put patients in jail if they refuse to take treatment, and they have to stay there till they get their treatment. So they have to take the treatment to protect the community. So that is somebody who is a situation where they may not have autonomy. So there certainly are exceptions. The next one is veracity. Veracity, the duty to be truthful. He's saying the oath with his fingers crossed behind his back. It's going to lie. So the duty to be truthful, healthcare providers need to be truthful and honest with their patients. If a patient was starting chemotherapy and asked about the side effects, the nurse practitioner practicing veracity would be honest about the side effects that they can expect with chemotherapy. Nurse practitioners who practice veracity, think about this, promote the patient's right to autonomy. Giving them true information promotes them to make appropriate decisions for themselves and honest decisions for themselves that could benefits will outweigh the risks. So not being truthful to try to protect them does not promote autonomy. Patient autonomy is the right of competent adults, again, to make the decisions about their own medical care. So truthful information is a vital part of that. Okay, thank you. We'll continue in the next lecture with legal terms.